Okay, we have lots of news to start with today. Some good, some not so good, and some absolutely terrible. And we're starting there. What is taking place right now in the country of India is almost beyond words. It's a complete humanitarian crisis as hospitals are collapsing under the pressure of a COVID explosion. If you look at the numbers, I looked this morning and thought there must be a mistake. It looks like they are almost literally off the charts. And in fact, these numbers I'm going to show you are probably underreported due to the poor infrastructure in much of India that is leading to people just dying in the streets. That's not a figure of speech, and potentially not even being counted in the number of dead from COVID. So cases in India have surged to a pandemic high of 320,000 cases per day. India previously had just one peak in mid-September. They did a good job for a long time. This new peak is more than 3 times worse their previous peak. And the deaths are just as bad, spiking most recently to about 2,000 deaths per day. And again, probably under reports of the real numbers because of the disconnected and rural nature of much of India, where we just don't even know if these numbers are actually the full story. Now, I think it's important to understand as we sit in the United States and look at this, that because of India's high population, India has 1.3, almost 1.4 billion people. We have about 330 million here in the US. We still have higher per capita case rates and per capita death rates than India from the start of the pandemic. The difference, of course, is that we never saw rates of growth like this. If this continues for even 2 more weeks, we could have a dramatically different story. And the level of hospital collapse that India is experiencing is different than what happened in the United States. We did get to full ICUs, and we had a very brief period where we were getting to the limit on ventilators. But what's happening with medical facilities and supplies in India is tragically almost unbelievable. They are out of ICU beds in many places. They are out of oxygen in many parts of the country. I saw one report last night where they were reporting from the main sort of meter for the hospital's oxygen supply. It was just at zero. People being left outside of hospitals, waiting for care. Some are just dying in the streets. The images are absolutely horrifying. New Delhi in particular, which doesn't produce its own oxygen and is dependent on getting help from other areas. To call it critical shape doesn't even really explain what it is that's going on there. A bunch of Delhi hospitals tweeted essentially SOS messages over the weekend saying we need oxygen supplies. At least 20 critically ill people died on Saturday after oxygen supply was delayed. They ran out and it took a period of time before they were able to get more. Other countries are trying to help, but it feels like it started too late. Not to be critical of people that are helping, but we saw this coming. And we fortunately now see Joe Biden sending ventilators and PPE and test kits and more medications. Many other countries are doing the same. The UK is sending ventilators. Many countries are doing things, but arguably too late to help many of the people that are dying daily at this point in time. And yes, there's also some vaccination happening there relatively slowly. Some countries are sending more vaccines. We know from looking at the numbers here in the US, it takes a while for the vaccines to make a difference. You start vaccinating. After 2 weeks, that first dose provides 85 or 80% protection. Then you need excuse me, that second dose. And that is a slow process before it makes an impact. Vaccination won't solve the current problem happening in hospitals as we speak with 3 people dying every 2 minutes. Also going in very much the wrong direction in terms of larger countries are, to some degree, not like India, but the Netherlands, Germany, and Colombia are also seeing some modest upticks in terms of larger countries. And by the way, my birth country of Argentina, just a continued disaster there with a completely incompetent leadership, lack of transparency, strict but unenforced rules, vaccine cronyism. One elected official found with vaccines in his trunk and said, oh, I was bringing them to some hospital. I mean, just about everything you can imagine. It's been happening in Argentina. I have friends who just flew down vaccinated, said that accurate mask wearing was at about 50%. Shop owners are all wearing masks from what you read, but you walk in and the mask is down over the throat. Like, it's a complete and total disaster. And the numbers there are also reflecting that. So globally, you actually need some nuance to see what's going on. You have some large countries like India that are disproportionately making the global numbers look bad. We see a resumed case decline in the United States. We are now about 3 weeks from when Israel saw cases go down 90+%. It looks like we are going to start seeing very good numbers. Last week, I said we were 4 weeks away. Now it looks like we are 3 weeks away. And then at the same time, if you look at just the global picture, you say, are we really making any progress here? We are, but we're also losing ground in certain places. And it's going to be, listen, this will go into 2022 when you consider that many countries won't even really be able to start vaccinating in a serious way until then. Never mind the issue of vaccinating children. We hopefully are getting closer to that. Submitted for approval on one vaccine. Pfizer has submitted for approval on 12 to 15. They did that at the beginning of April. We should be days from the FDA reviewing that, and hopefully we can expand that to 12 plus. So many different things to be looking at, some good, some not so good, and what's going on in India, absolutely terrible, which makes this next story particularly difficult to parse. The European Union will be opening to vaccinated American travelers at some point this summer. Let's talk about that next. If you are anything like me, you probably aren't thrilled with the idea of going into a doctor's office right now. And thankfully, there's a practical and affordable way to take control of your health and get personalized care from the comfort of your home. It's a service called SteadyMD. They're one of our sponsors. You take a quiz, you get matched with a licensed primary care physician who understands your health needs. You have a 1-hour video call with your new doctor. You establish a meaningful relationship with them. And after that, your doctor is available to you anytime by text, phone, or video chat. This is not a random doctor on call. Each doctor at SteadyMD has a limited number of patients, so they actually have time to listen to you. You get the personal attention that you deserve. They can do almost everything an in-person doctor can do: perform medical evaluations, talk to you about health concerns, send prescriptions to your home or local pharmacy, and anything they can't do online, they'll quickly set you up with an in-person provider to do, things like blood tests, as an example. You don't need insurance. It's only $99 a month with no other fees or copays. There are so many practical advantages to using SteadyMD for primary care, and it's also so much more affordable. Go to steadymd.com/Pakman to take the free quiz, see which doctor is right for you. I took their quiz. They matched me with a doctor who specializes in my particular health needs and situation. The doctor they gave me is a really perfect fit for me and my medical needs. There's no risk, no commitment to get started. Just click the link right underneath this video.